Hello and welcome back to Tuesdays with Tom. I'm Greg. We're going to continue a conversation we were having about the differences between home care organizations and residential care facility for the elderly, but now we're going to take it to the differences between residential care facility for the elderly and skilled nursing facilities. This is a topic of confusion for a lot of people entering into the touring process. They're coming into our facilities and they're looking for a certain kind of care, and they're really not understanding what the differences are. As an administrator in this setting, you should be able to guide these individuals through this process known as the Continuum of Care. If you think of the Continuum of Care, early on, perhaps somebody would need something like home care. Eventually, maybe they would need a residential care setting for non-medical care, and then perhaps later on, after some sort of an incident or medical situation, they might need nursing care at a skilled nursing. So the difference between Rcfe and skilled nursing would be this. Rcfe, Residential Care Facility for the Elderly, is regulated by the California Department of Social Services, Community Care Licensing Division. This is a social model of care. We do not provide any medical care in these facilities. What we do is manage the day-to-day activities of daily living, medications, and monitor the health conditions of the residents there. Also, these are residents. They are not patients because it is a non-medical setting. Caregivers in this setting require a certain set of training, 40 hours initially within the first month of employment. Additional training as needed based on the type of care, and if the caregiver is going to be a medication aide, there's an additional set of training for that portion of the job as well. There is a fingerprint clearance that's required for these caregivers, and it is constantly monitored. The administrators for these buildings are required to take about an 80-hour, or actually an 80-hour training, something that I teach. And once they take that training, pass an exam, they can apply to be an administrator, and that's all it takes. Skilled nursing is quite different. They are regulated by the Department of Healthcare Services. They are truly a hospital setting. The environment there is much more clinical. There's additional equipment there that's required for helping people with their health care needs. The people in these settings generally are there because they have a health care necessity. It is generally due to a chronic illness or something of that nature. The way people pay for skilled nursing is usually through Medicare or Medi-Cal. In other states, it's called Medicaid. California, it's Medi-Cal. And these are insurances that skilled nursing facilities will bill for these services. The difference there between Rcfe and skilled nursing is that the residential care setting is generally private pay. There are some options that can help, but it is not covered in general by Medicare or Medi-Cal, with one exception. The assisted living waiver in California is a component of Medi-Cal, and there are some components of the Veterans Benefit Administration that can help cover assisted living care as well. Generally speaking, with skilled nursing, people are not there unless they have a 3-day stay at a hospital, and then they are sent to the skilled nursing for rehab. However, some skilled nursing facilities take long-term care and have beds set aside for long-term care for people specifically on Medi-Cal. But in all cases, these individuals will have some health-related need that a nurse or a doctor will need to attend to. There are a lot of similarities between the two, but there are also many, many differences. It's important that you, as an administrator, are able to tell these people the differences so that they understand what the continuum of care is like and what the need of their loved one is. So if you have any questions on this, if you're uncertain about how to go about it, feel free to reach out to us. You can reach us at 530-894-2114 or through our website at www.communitycareoptions.com. I'm sure I didn't cover all of it, but this is the beginning for you, so take care.